Now recognize California for 5 minutes of questions.
Thank you, Mr. Chairman. I think this is a super important select committee to actually try to understand what happened, what worked, what didn't work, what mistakes were made. I'm a general internist by training, was chief medical officer for Sacramento County staff, a public health background, have done a ton of global health security work and pandemic preparedness work, and chaired the first hearing in Congress, House and Senate on at that time, the novel coronavirus. So fairly early on was paying attention. A lot of the points that both sides bring up are valid. I mean, early on, there were real conversations about bifurcating treatment to protect our older Americans, while actually allowing younger Americans to get naturally infected. That was legitimate. Folks that are well respected. We obviously didn't go in that direction. I think we ought to understand, what the impact of that was. I do believe in vaccines. I have gotten my booster and my bivalent booster, but I also understand that the vaccine mandate, I think in an unexpected way, there was dramatic pushback in the American public. Was that the right approach? Was there a better way to encourage folks to get vaccinated? I don't know, but I think we ought to understand that. We ought to understand the net impact of the vaccine. We ought to understand the spillover. Is it going to negatively impact our young people in America who may not, certainly, there are unanswered questions that I don't have. Early on, Japan didn't shut down dramatically. Older population, dense population, they were still riding their subways. We didn't see dramatic COVID in Japan. I'd like to understand why that was different than New York, another densely packed city. Was it a different variant? Was it cultural issues of masking, bowing, not shaking hands? Was there crossover immunity from SARS, MERS, other things? Legitimately, I think we ought to understand that to better inform how we move forward. I think those are super important studies. We could do studies. We know, the state of Florida took a very different approach to, mask mandates and shutdowns, et cetera, versus, my home state of California. We ought to study, we ought to do a retrospective study looking at how different cities, different states approach this and use that to inform how we move forward. Clearly there's a logic that, wearing a mask for respiratory transmitted disease would probably reduce particulate infection. That makes sense. Did the mask mandate work? Did it not work? Dr. McCary, you cited the Cochrane report. Obviously, that's one conclusion. I think we ought to, maybe you have to have a certain level of penetration of mask work. I don't know the answer to that question, but those are all legitimate questions for us to ask and research. Dr. Kuldorf, Sweden took a different approach. We ought to, study that, compare it to what we're doing here. Clearly, closing schools down had a net negative impact on our kids. We ought to understand what that impact is. We ought to understand the long-term effects of that impact, because we may find ourselves in another pandemic. We're not totally out of this pandemic because we're seeing the irresponsibility that's taking place in China right now, where zero COVID at least was a policy. What they're doing right now is reckless, where you may get a new variant coming out of this wide open policy. I don't think it'll happen, but we ought to use that to inform how we approach future potential pandemics. So, I'm very open to going back, looking backwards and getting a sense of what worked, what didn't work, and using that to inform policy going forward. It shouldn't just be the government. It should be academia. It should be science-based. It should be fact-based. As doctors, we all have had to do morbidity and mortality rounds where we've had to admit our mistakes, because that's how you get better. You actually admit the mistakes, you learn from the mistakes, and then you use that to move forward. So there are lots of questions that I still would like to learn about COVID-19 to help inform how we approach the next pandemic and what we should do. So Mr. Chairman, I look forward to a lot of the questions on this committee. And again, I think this is super important for us to take a look at.
Thank you, and I kick off this important. Now recognize Dr. Miller Meeks for 5 minutes of questions.
Thank you, Mr. Chair, and I thank our witnesses for being here. Dr. Benjamin, I want to thank you as a fellow public health official. So many of you know that I'm a physician. I'm also a former director of the Iowa Department of Public Health. And imagine my first foray into Congress, sitting on this select subcommittee for the past 2 years, when I had the opportunity to ask questions of Dr. Fauci and Dr. Walensky, and then public health directors, to ask them about infection-acquired immunity and herd immunity. And you would have thought that that was a novel concept, as novel as SARS-CoV-2. So in asking this question and asking individuals, I actually put forward a bill mandating that all insurances, both public and private, cover for testing for humoral antibodies and also T-cell antibodies, trying to push this issue that if you have immunity, which, can you all just answer for me quickly, what's the purpose of a vaccine? Dr. Koldroff? Why do we vaccinate people?
Well, vaccine is sort of a substitute for natural immunity. So if you haven't had the disease, then you get the vaccine because it gives you protection without the risks of having the disease.
Dr. McCary?
For example, I'm a big fan of the measles vaccines. I'm not vaccinated against measles because I had measles before it was available. No reason for me to take it.
It's to downgrade the severity of illness among those who are high risk and not already immune.
Dr. Bhattacharya?
What Dr. Makari said and what Dr. Kuldorf said. We want to, if it can prevent disease, great, but then also to mimic what happens with natural infection without having to have natural infection.
And Dr. Benjamin?
Yeah, it teaches your body to respond to an infectious agent.
Yes, so in essence, we vaccinate people in order to develop immunity. So very early on in the pandemic, certainly by the time the Delta variant came along, we already knew at that point in time that infection-acquired immunity, if we had looked at real-world evidence, which we in the Doctors Caucus and we on members of this committee asked the FDA and CDC to look at, we would have acknowledged that there was infection-acquired immunity. It was valid, but yet our message to the public was that you're mandated to get a vaccine. And I think, as you've alluded, this eroded trust in our public health communities. And I can tell you, as a former director of public health who has good relationships with all of my county public health directors, and in Iowa there are 101, even though we have 99 counties, they felt that this was a misstep by the CDC and a misstep by the FDA. So can you expand a little bit on infection-acquired immunity, the validity of it in SARS-CoV-2, and then whether or not we should be acknowledging that in children, placing SARS-CoV-2 or COVID vaccines on the recommended list for vaccines will, I think, hurt most of our low-income, impoverished children, our Head Start programs, as Dr. Joyce had mentioned.
Yeah, by forcing children to have a vaccine that they don't need because they've already had the disease, that undermines the trust in other vaccines, like the measles vaccines or the polio vaccine, and that's very, very serious. I think during the last several decades, we have the never vaccinate people or the anti-vaccine people have tried to undermine the trust in vaccine, but with very little success. But the vaccine fanatics who wants to vaccinate every person in this country, even though they are children who has very little risk for it, even though they have already had the COVID, that has undermined the trust in other vaccines enormously, creating enormous vaccine hesitancy.
So not allowing their provider or physician to determine the risk and the benefit.
Yeah, and also people themselves, because people know that about immunity. We learn that in school. People know that if you've had a disease, you had...
It wasn't until I came to Congress that I found out infection-acquired immunity was a novel concept.
Yeah, I guess we knew about it since 430 BC of the Athenian plague until 2020, and then we didn't know about it for 3 years, and now we know about it again, so.
We have a little bit more time. Do any of our other witnesses want to comment?
I mean, I want to echo what Dr. Kuldorf said and the seriousness of this. The putting the vaccine on the childhood schedule, this vaccine, where there's deep distrust, essentially sends a signal to the American public that these are equivalent to the polio vaccine, the measles vaccine, the DPT vaccine, all of which are absolutely essential for the health of children. Putting this on the childhood schedule decreases the uptake of those, then we will look back on this as a seminal mistake in American public health.
Thank you so much. I yield back.
Thank you.